So the mission of ECHO is, I think, easy for pretty much everyone to get behind. How do we enhance the health of children for generations to come? And there's currently about 60,000 children and their families that are participating in ECHO from across the country. There are 5 key outcomes that ECHO is focused on, and there's about 1,200 scientists involved with ECHO as well that represent each of these areas. So pre, peri, and postnatal reflects the time period around the point of delivery. So this would include things like looking at the effects of prematurity on later development, or different decisions made at the time of delivery, medications or fetal heart tone, all the things, and how that may affect later on development. Upper, lower, and airway outcome looks a lot like asthma and different respiratory infections, obesity, self-explanatory, and then neurodevelopment, which would include things like autism, attention deficit. That's where we also put things like depression and anxiety. And then there's positive health, which is actually was kind of a newer addition to ECHO, and it's one that has been really kind of fun because it's looking at positive health, not just the absence of disease, but the presence of things that frankly are all the things that we want in life for our children, in terms of happiness, satisfaction, and a lot of aspects related to resiliency. There are key exposures that we're looking at, and again, looking primarily at very, very early life exposures in the prenatal time period, even the preconception time period. And these include lifestyle, physical and chemical exposures, and psychosocial. So the lifestyle, for example, could be activity level. Activity level of like mom during pregnancy, for example, or of the family life or in early life. Physical and chemical could include things such as prenatal exposure to lead or some other some metal, for example. I was thinking of some other presentations today. Metal, other things in the environment. And then psychosocial could be anxiety, depression, and again, all of the positive things that go with that as well. So ECHO, again, we have sites from across the country, and we have one protocol that's done in all of these very, very different areas. There's currently 45 different ECHO grants that go with this, that include 77 different study sites. We represent 2 right now, soon to be 3. And there's, we currently have about 6,000 pregnancies enrolled just from our sites alone. I always like to show, so obviously the people who made this map thought Rapid City was a little further north, but you know, they got it close anyway. At least it's not up in North Dakota, I guess, right? But what I also like to show is you can see there is not much representation from the middle of the country. And so really, really important that we make sure that our part of the country and region are represented in work like this. So here's just some specific questions, for example, that ECHO is looking at answering. So asthma, for example, is one of the most common chronic conditions of childhood, and we know that racial and ethnic disparities exist. When do they start? How can we prevent them? Childhood obesity can be very resistant to individual interventions. How do policy solutions work? When might community level interventions be effective? To what chemicals are pregnant people most exposed, and what are their effects then on later development? Media use, this is something that I think we all fight, right? Ourselves, as well as all kinds of things. It's really become ubiquitous. And what is the balance of the positive and negative effects on both mental health and well-being? So there's some commonality between all of the questions that ECHO tries to answer. And one is that they be solution-oriented, meaning that they're important to people who are going to use this information. So that could be a parent, that could be a clinician, that could be a policymaker that is able to use the information and put it into place. That it's driven by the communities and investigator passions, and it's also feasible. Sometimes you can get the first 2, and if you don't have the third one, it's just not going to happen. And again, we're trying to inform policy, programs, and practice. So a large diverse cohort, again, with around 60,000 participants, it really takes a lot of effective collaboration across people from many, many, many different backgrounds. And we really are, the whole is greater than the sum of its parts, which is where the team science comes in. This really does reflect, I think, a direction that science is going more and more, is incorporation of different viewpoints, not just from different scientific specialty areas, but also, again, the people who are involved as participants in the studies, communities that are involved, and really love that ECHO kind of embraces all of those things. So how has ECHO been addressing different scientific questions? So I'm going to turn it to my colleague and friend, Dr. Christy Hockett.
Okay. All right, so we're going to look at a couple examples that ECHO, some studies that ECHO have already published that are out there. So looking at ECHO science, first we're going to look at childhood obesity. So I really love this paper, and this was an example of how ECHO has used a natural experiment in real life. And so if we think about the Healthy Hunger Food Kids Act, this was passed in 2010. This act set nutritional guidelines for the National School Lunch, Breakfast, and Snacks program. And really affected tens of millions of children in the United States. So previously, evidence had suggested that this act was associated with higher dietary quality. However, there wasn't much really known about how it was affecting or impacting the obesity rates in kids. So what ECHO was able to do is they took 50 ECHO cohorts, which equal to about 14,000 children between the ages of 5 and 18 years of age. And so we had a total of roughly 26,000 measurements, height and weight measurements. And we calculated the BMI Z-score. And what we did here is we started in 2005 and followed the kids, we had the data retrospectively, and was able to estimate BMI Z-score for 15 years. And then the act passed in 2010. We allowed roughly a 5-year implementation process. So the schools were able to implement this act. And 2016 is when it was pretty much essentially enacted as a nation across all the schools. And as you can see here on the far end of the graph, you can see that the BMI Z-score shown in red is then decreasing from 2016 to 2020. So this is really exciting because this was the first time that we were able to show that there was a decrease in BMI in the first few years following full implementation of the Healthy Hunger Free Kids Act. Try to say that really fast 5 times. And that there was this reversal in trend during the decade before program implementation. And it was a really nice example of how national policies can have a wide benefit on child health. And particularly we had looked at this by income status and showed that there was even larger effects on children from lower income families. So the second study that I wanted to highlight investigated the longitudinal relationship of severe bronchiolitis during infancy with the incidence of asthma. We particularly were interested in looking at differences within subgroups or subpopulations. And then we also wanted to look at other risk factors in addition to bronchiolitis and see how the magnitude of effect differed in association with the incidence of asthma. So in this study, we had 53 ECHO cohort sites that provided data for about a decade, so 2001 to 2021. We had a little under 12,000 infants, and our bronchiolitis prevalence was about 10% in this population, and this was specifically around hospitalizations. The outcome that we were interested in was a doctor diagnosis of asthma by age 12 years. And so this was gathered by medical record review or self-report. And then we used a time to incidence analysis. and we were able to see that there was an association with severe bronchiolitis and the rate of developing childhood asthma. So you can, our average prevalence of asthma, or the incidence of asthma, was 15%. In children who didn't have severe bronchiolitis, so who were not hospitalized, the rate was about 14%, or the prevalence was about 14%, where in those that had severe bronchiolitis, the prevalence was 24%. Then we also looked at other risk factors that are associated with asthma. So these are your typical risk factors for asthma, and we wanted to look at the magnitude effects. So you can see here on the far right-hand side that bronchiolitis hospitalization was the second largest effect when looking at the association in the incidence of asthma, with parental asthma having the largest effect. So really the take-home message here was that infants hospitalized with bronchitis was at least were at 3 times the risk of developing childhood asthma. Sorry, my picture is in the way here. And that there's a higher risk of asthma for other demographic and medical factors. And so really this leads to ask, like, are there hospital or household interventions that could potentially reduce the risk of bronchiolitis and thus asthma in children? We just wanted to highlight a couple other studies that ECHO has looked at, or just examples of how ECHO data has been used. Is that we had one study looking at COVID family hardships and how they were associated with increased child stress, and how that child stress was associated with lower life satisfaction. We also looked an example of prenatal exposures, or thinking about prenatal exposures during pregnancy. We looked at a group of prenatal women and saw that there was universal exposure to multiple chemicals during pregnancy, and we even saw a rising level of replacement chemicals. And so really the next step in that analysis, or in that focus, is understanding what are these replacement we know what the replacement chemicals are, but how are they now associated with health outcomes in children. We've also looked at prenatal substance use, both illicit and illicit, and looked at how they were associated with externalizing and internalizing behavior in school-age children. Okay, so that was a lot of science, and ECHO does a lot of science, and that because we have, like Amy was talking about, there are many investigators across the country that specialize in a lot of different areas. We want to know, so because ECHO is coming to Cheyenne River here soon in the next coming months, we wanted to get your guys' input on what you're interested in. Okay, so get out your phones. And I hope I did this right. This is the first time I've done Slido. So if you take your phone and you do this QR code, it should ask you, and I should get like live results here, but if you could rank the ECHOs, these are the 5 ECHO outcomes, and we're curious, what are you guys interested in the most? So rank it most to least.
Yes.
Mine is not, but I think if you just go to slido.com maybe and type in that link. Try that.
Whoa. The internet, big deal. Will it save it, Christy? What? Will it save it? Yes. Okay.
No. I think. No, I'm pretty sure.
I like it.
Okay, we got 6. Obviously have a typo in positive health, so. Okay.
Just rank them.
Oh,
Looks one more person is ranking. Okay, So we have eight folks that ranked it. It looks like positive health, then obesity and neurodevelopment, followed by pre-peri-post upper and lower airways.
Not that I don't trust your technological skills.
Okay, so we got, oh. Okay, I think you guys can keep taking that. Okay, now, okay, that's,
Oh, you got one to work.
I got one to work. Okay, let's do, I can't do this poll.
Just show me.
Because it just has option 2.
What's option two
What is
supposed to
option
be?
2?
Option 2, what do we want option 2 to be? Do we want it to do psychosocial or physical and chemical? Because there's technically 3.
Psychosocial.
Okay, let's do lifestyle and psychosocial.
While we're ranking, can you give a brief description of the two?
Yes, so lifestyle would be like prenatal, physical activity, diet, things like that, sleep. Psychosocial would be stress, depression, and anxiety, positive health. Relationships, maybe. Okay, thank you guys for bearing with my technology. All right, okay, so thank you guys, this is very helpful. So we just wanted to kind of think about what does ECHO, we want to talk about South Dakota ECHO and our particular cohort sites here in South Dakota. And what does this mean for CRST community members? So ECHO has been going on, like Andy said, for about 8 years. We recently just got renewed for our second cycle, or what we call cycle 2. This started back in 2023. And the focus of this cycle is really to expand the representation of rural and American Indian communities in South Dakota in our cohort. And so to do this, we have expanded our rural Avera clinics that participate in ECHO. We have opened up an office in Pierre, South Dakota, which is really central. Most of you guys know where Pierre is, but for those who may not, it's in the central part of the state and it's our state capital. And then we also recruit from our outlying hospitals and clinics like Aberdeen, Mitchell, and Yankton. And then another part is we have been working with Missouri Breaks to bring ECHO to Cheyenne River. We officially got the tribal approval signed last Friday or 2 Fridays ago. And so we're just working to get the actual signatures to move forward. And then we have started to meet with Oglala Sioux Tribe as well to see if they are interested, but to see how that may look in Pine Ridge. So I just wanted to briefly talk about the process that we went through to bring ECHO to Cheyenne River. First, we worked with Missouri Breaks, we got community feedback, we talked to their community advisory board, and really wanted to hear what was important to the community, what are considerations that we needed to think about as we were bringing ECHO to, if we were to bring ECHO to Cheyenne River. And then working in partnership with Missouri Breaks, we wanted to ensure that we had the appropriate steps and processes to respect tribal and data sovereignty. And so these are just some of the things that we have been working on over the last 1.5 years to develop. So we abide by the Cheyenne River data policy, and then through that, in addition to the data policy, we created an ECHO Cheyenne River data use agreement that just clarifies some things of the policy, but just we want to make sure that we're really acknowledging the data sovereignty of Cheyenne River and conducting research in an ethical and respectful way. We also have specific consents. We are working to create kind of this one-pager to really talk about what ECHO is and really proactively think about and inform the participants of what they're signing up for, and so making sure that that they know what it means to be a part of research and that they can say no to things and they can say yes to things, and being very open about that. And then we have particular steps in our publication process as a nationwide network to make sure that we go through the appropriate approvals for publications. And then we have biospecimens. In ECHO, we collect a lot of biospecimens, and so we want to make sure that we're collecting them again in a respectful and ethical way, in a culturally appropriate way. And so we've been working with Missouri Breaks to make sure that that is being done, and that ECHO recognizes those things on a national level. So we're excited because we're going to start recruitment. So if you guys know any women or people who are pregnant and are less than 20 weeks, please have them call Ray. And we will start enrolling here in a couple, very soon after we finalize training and everything. These are just some examples of recruitment material and what, if you guys start seeing kind of flyers around town, what they're going to be looking like. This is a participant journey map, so we sit down and as through the consent process, we talk through the participants and say, this is what you can expect the first 3 years of being a part of ECHO. We're gonna have prenatal visits, and then we'll talk with you a couple times throughout the first couple years of the child's life. We have a mobile unit that we recently got. We are very excited to use this mobile unit. This just gives a little bit of an example of what it looks like both on the outside and inside, and so hopefully you guys will be able to see this unit around the community and then maybe in Pier and driving down the interstate, you can wave to us and say
It doesn't drive very fast.
When we pass you.
Lots of time.
a lot of time.
When we blow past it.
And then this is also, I can't forget Boom Boom, this is Boom Boom the Buffalo. He is our mascot for the bus. We have activities for the kids. We have kind of Boom Boom stuffed animals and stickers, and then on our Facebook you can see Boom Boom travel across the state to follow the bus. So we are trying to make it fun and interactive for our participants as well. ECHO dissemination, this is the ECHO connector. If you want to learn about ECHO, if you want to get a bi-monthly newsletter, you can sign up. Here's the QR code, but you can also just go to echochildren.org and sign up there. But this is a bi-monthly email that just kind of talks about ECHO, what ECHO as a consortium is up to, and you get live updates. And then return of results is important for both our South Dakota ECHO site, but also as a national ECHO. And so on the right here is just an example of a snippet of return of results that we provide back to the participants and to the clinic providers, and engaging both, kind of trying to engage on multiple levels to highlight what ECHO is finding in their research study, and informing participants and thanking them for being a part and allowing us to conduct the research that we do. You are also able to find this information on the ECHO website if you go to publications and research findings, and then all of these are different types of return of results that ECHO does out into the community. Okay, this is my last slide. Hopefully it works, and then we're done. Okay, so this is, we have ECHO outcomes. We have broad range of outcomes and exposures. I want to know specifically what topics are important to you and your family. And this is a word cloud. So it could be, do we want examples?
You type anything?
You can type anything. Or maybe thinking in the broad range of ECHO and results that you could possibly get. What would you want to know about? So it could be blood pressure, gestational diabetes, stress, chemical exposures, air pollution,
Child development.
child development, ADHD, autism, sleep health, yep. Sleep,
Even the number of hours you sleep every night, which it turns out parents are horrible at guessing what their kids sleep.
All right, we will let you guys finish up, but thank you so much. This is the end of our presentation, but thank you for participating in our interaction.
Technical skills.
They were all very
Technical skills.
But my question is,
That we
is
typed
there
it
any
in.
studies and, very
Now we have to go all the way to
mother
it's the community panel. We get to look at the pieces on the
diabetes,
stage.
So now obesity and mom, but
children.
yes, there is national, and I don't know that we have anything yet, but this ECHO will do it. Like once our cohort gets in, and that's the cool thing is our data that we collected from our participants goes into the national cohort, but we can also do our own analysis to say, okay, just the Shining River moms, what do we learn from
I'm
out?
sure, Ray hasn't already talked with her yet. Definitely, you should, let me give you my number. That's no longer? Okay, but I'm guessing Ray may have already. But we'd love to talk with her. There, thank you. Let's be proud, she must be proud of you too.
Absolutely. So what they can do is just look at those two outcomes, diabetes and obesity in kids, and then they can do fancy analysis stuff that I don't know how to do, to say what are the main drivers of these two factors. And it'll spit out what it is, and then we can focus on those for policy, for education in the community, going to the parents to make sure they're aware.
Yeah, and how do you capture the parent?
That's the trickiest part, is getting the behavior change. Yep, you're right. You're right.
That is right now,
Yeah.
because
But that's
trying
one of the
everything,
things that's so nice too, that
I've been
since
working
we all
with
came in with kind of
program
existing
and
cohorts and
like
one.
I've
So we've
tried
got kids
a lot of
up
things.
to 21
But part
now,
of it is
throughout all the
education
different
is
sites, but then we're all
Right.
starting to do pregnancy, or some of
And
us,
these,
not everyone.
the symposium has all good
So,
ways to
one of the nice
do
things.
that.
Oh, so
Yes.
that's fun working with them. Okay, you're-
Yeah, and I mean, I have been pretty pleased with the community members' participation, but we have to do more. You know, one isn't enough because people have conflicts and, you know, life happens, so, yeah. But we are going to post all the recordings and hopefully people will continue to watch them after we get them posted.
Yeah,
That's the goal at least, yep.
So we're part of it.